This is Diana Mahoney reporting for Global Medical News Network. Dr. Philip Seo of Johns Hopkins Vasculitis Center discussed the evidence supporting biologic strategies in small, medium, and large vessel vasculitis at the Congress of Clinical Rheumatology in Destin, Florida.
The most exciting thing to happen in this last year is the use of rituximab for the treatment of Wegener's granulomatosis and microscopic polyangiitis. That data was presented last year at the American College of Rheumatology, and it really looks like it's effective in the short term, giving patients the first option since cyclophosphamide became standard of care back in the 1970s.
When should treatment with biologics be considered?
I think biologic strategies are especially important for patients who would normally use a cytotoxic agent for, but have some sort of contraindication, and certainly there are a large number of patients who fit into those categories. Older patients have a problem tolerating cytotoxic agents sometimes. You also sometimes have a case of a patient who's already seen a cytotoxic agent maybe 2 or 3 times and wouldn't be able to tolerate it a 4th time. And then finally, for younger patients where you're concerned about fertility, since about half of patients who get treated with Cytoxan will unfortunately become infertile afterwards.
What are some of the risks of biologic therapy in these patients?
Well, the risks are the unknown. I think especially with rituximab and some of the newer agents coming down the pike, you have to remember that clinical trials frequently only observe these patients for maybe 6 to 18 months. You really have to wonder what happens to these patients maybe 2, 4, 10 years down the road. And frequently those data will not be available because those studies aren't really being done. The second risk is just the idiopathic nature of the drugs. TNF inhibitors may be associated with malignancy in some cases. Those data are coming out now. Rituximab might be associated with a relatively rare infection called PML, and we won't know whether or not that's an important consideration for some time.
Reporting for Global Medical News Network, this is Diana Mahoney.